In medicine, we often overlook how the smallest discoveries can completely change everything. Take insulin, for example. Back in 1921, Frederick Banting discovered what is, at its core, just a small chain of amino acids. And yet, this one discovery transformed medicine and saved millions of lives. For patients with diabetes, a disease that used to be a death sentence, insulin became nothing short of a miracle, a simple peptide that gave people their lives back. And this is exactly what we are going to explore today, how peptides, these tiny molecules, can have such a powerful effect on the human body. And for those of you who don't know me yet, my name is Dr. Alla Zayons. I'm a specialist in infectious disease trained in St. Petersburg State Medical Academy back in 2013. I'm also certified in functional medicine by Functional Medicine University in the US and a diplomate of the American Board of Regenerative Medicine with over 15 years of clinical experience. Most of you probably know me as a regular speaker at longevity conferences, but today I'm especially excited to share this lecture with you because peptides are truly at the heart of many advanced therapies we use in age and regenerative medicine. And of course, I want to take a moment to say thank you to Dr. Lica and Longevity Code for making this event happen. And I know how much passion and effort they've put into bringing together professionals like us to share knowledge and move the field forward. So what exactly are peptides? In simple terms, they are short chains of amino acids connected by what we call peptide bonds. Think of them as the in-between step between single amino acid and full proteins. Proteins can be massive, made up of hundreds of amino acids, but peptides usually contains just 2 to 50. And that's actually one of their biggest strengths because they are smaller, they are more bioavailable, and they can target very specific functions in the body, like signaling, repair, or regulation. And to date, scientists have studied more than 1,500 different peptides, and the list keeps growing. Every year, we are learning more about how these tiny molecules can influence everything from metabolism to immune response and to aging. So let's take a closer look at what makes peptides so unique, starting with their structure and function. First, from a molecular point of view, peptides can be either linear or cyclic chains of amino acids. And if there are fewer than 10 amino acids, we can call them oligopeptides. And more than that, we are referred to as polypeptides. And now what's important to understand is that these molecules are not foreign to our body. Peptides are naturally produced by our own cells, and they regulate a huge number of vital processes: metabolism, tissue repair, immune function, inflammation, communication between cells. All of that is influenced by peptides. But what really makes them powerful in clinical practice is their biological activity. They act like bioregulators. They don't force the body to do something unnatural. Instead, they send precise signals. Start this process, stop that one, repair here, calm down there. And because of this selective and targeted action, they often come with a fewer side effects compared to many conventional drugs. Today, we have generally few groups, and we classify the peptides by its function. We have a hormonal peptides that regulate metabolism and physiological process like insulin, somatostatin, CGC, pamorelin, tesamorelin. We have a neuropeptides that involved in nerve signaling transmission like CLUNC, CMAX, DCAP, digexa. We have immunomodulatory peptides like a tymosine alpha, for example, regenerative peptides, and most of you know them very good. It's a BPC157, tymosine beta. We have a mitochondria peptides that enhance mitochondria function. It's a MOTS, for example. And we have definitely antimicrobial peptides that inhibit antimicrobial and antibacterial, antiviral activity like defensins, catalycins. We have antioxidant peptides like a glutathione. All of us knows this peptide and we quite commonly use it. We have epitalon here. And yes, we have anti-aging peptides. It's again epitalon and dihexa. And next peptide is that's truly earned its reputation over the past 30 years is a BPC 157 or body protection compound. This is a pentadecapeptide, a slightly longer chain, originally derived from a protein in human gastric juice. What makes BPC special is its remarkable ability to protect and regenerate tissue. It's very stable in the body. It's resistant to breakdown by gastric enzymes, so it stays active where it's needed most. Now, let's talk about how it works. First, yes, it will stimulate the angiogenesis, that's the growth of the new vessel. This means that better blood flow to injured areas, accelerated healing, and it does by influencing growth factors. Second, it enhances fibroblast migration. So fibroblasts are the cell responsible for rebuilding damaged tissue. So this speeds up recovery. The third one, it modulates inflammation. So BPC helps reduce inflammation, protecting tissue from further damage during healing. The next one, it will be interacts with the nitric oxide system. It's optimizing important proteins that are essential for tissue growth. And finally, it supports neurogenesis and offer protection against neurodegeneration. In short, BPC 157 is a powerful aligned healing, whether it's muscle, tendon, ligament, gut lining, or even nerve tissue. And here, on the left side, we basically have clinical trials. And this is a clinical trials results comparing BPC with a methylprednisolone and sulfasalazine in patients with a cholocutaneous fistula. And the results is quite striking. So BPC 157 showed the most advanced healing. So patients treated with it achieved full recovery within 28 days. Sulfasalazine also had some positive effect, showing improvement, but not to the same extent. And methylprednisolone demonstrated the least progression in healing in this study. So this clearly highlights the powerful regenerative and anti-inflammatory potential of BPC 157 compared to more traditional treatment. So what's the indication for BPC? We usually use it to help us heal gut. It's a healing of gastric and intestinal ulceration because it's promote regeneration of the gastrointestinal lining and accelerate the healing of ulcers. It helps with recovery after muscle, tendon, and even ligament injuries. It supports tissue repair and reduce recovery time for musculoskeletal injury. It helped to treat us inflammatory bowel disease, not separately, but we very common use it to the patient as a part of our 5R protocol because it helps reduce inflammation, promotes healing in conditions like a Crohn's disease, ulcerative colitis. It helps with the gene expression modulation because it increases stem cell synthesis, it's supporting tissue repair and regeneration. It will even help with the spinal cord injury treatment, its potential for accelerated recovery of nerve fibers and promoting nerve regeneration and functional recovery. And it's very useful for the patient who has a hemorrhagic cystitis and bladder disorders. It aids in the treatment of blood inflammation and damage, promoting healing and reducing symptoms. And in this case, we usually don't use it like an oral caps. We usually prescribe it for the patient like a subcutaneous injection or even locally with the help of our urologist. It helps to accelerate of bone tissue regeneration, has a cytoprotective agent activity, support for cachexia in the cancer patient, protect our liver from the toxic damage. It even helps us with a burn healing stimulation, and it's work like an antioxidant. So as you can see here, BPC, a versatile peptide with strong clinical potential across many systems. How we usually use it? We usually have two options. We can use it orally or subcutaneous. I know now available also a BPC in the spray form, but generally we don't use it because no sense. But if we're talking about the oral We have a cups, 500 mcg. We can use it once a day, 30 minutes before food, usually in the morning. For synergetic action, it can be combined with a 500 mcg of KPV. This is another peptide. And course duration, usually 1-2 months, depends on the condition. If we're talking about a subcutaneous injection, it's usually 0.3-0.6 mcg per day. And course duration shorter will be 30 days. For injuries, the dosage is 300, 500 mcg twice a day. Again, there is a side effects we use with caution in a cancer patient as it has a pronounced angiomodulatory effect. So basically, BPC able to stimulate angiogenesis, that means growth of new vessel that can stimulate cancer process in the patient with active cancer. And the next one is a Epitolone. Let's move to it. It's a synthetic peptide made of just 4 amino acids. It's a glutamic acid, aspartic acid, glycine, and alanine. Epitolone is an analog of a natural peptide produced by the pineal gland, which plays a key role in regulating aging, cell regeneration, and maintaining the body's balance. So how does epitolone works? It stimulates telomerase activity. So basically, what does it mean? It helps us to increase the length of telomeres. And this is a small, tiny cup that covers the chromosome from mutation. So as all of us know, as we age, the length of telomeres significantly decline. So when it reaches some point, the cell death or becomes senescent. So epitolone help us increase this length by increasing telomerase activity. It regulates circadian rhythm by normalizing melatonin secretion, which improves sleep quality and overall biological timing. So one of the main indications for epitolone, this is a problem with falling asleep, not maintaining sleep. We can combine it with a melatonin for synergetic effect. Epitolone has strong antioxidant effect, reducing oxidative stress by limiting free radicals formation. So here we have to keep in mind, if the patient on ozone therapy, we will not prescribe epitolone in the same week. So there is supposed to be gap because they're working in the opposite direction. It boosts the immune system by enhancing thymus function and increasing T cell production. We usually provide for our autoimmune patient epitolone course for 10 days, followed by combination of thymidine alpha and thymidine beta. And lastly, it promotes DNA synthesis and repair, helping cell regeneration and tissue recover more effectively. Epitolone supports healthy aging by protecting and rejuvenation cell, improving sleep, and strengthening immunity. So what's our main indication? Of course, anti-aging therapy. This is the main anti-aging peptides because it affects the telomerase, one of the hallmarks of aging. It supports nervous system, improve memory, concentration, reduce stress level, improve quality of sleep by normalizing melatonin synthesis, which can help with insomnia and sleep disorders. But again, here we have to keep in mind that most of our neurotransmitters, like serotonin, this is a precursor of melatonin, it synthesizes in the gut. So if patient has some gut disturbance and problem with the gut, especially leaky gut, we first have to address the gut health and then prescribe something for like epitolone. But epitolone can be temporary solution. It helps with the tissue regeneration to enhance recovery after injuries and surgical procedure. But generally for this indication, we use it only if BPC, thymidine beta, and CGC will not be available. And it helps with the hormonal balance support. It helps with the hormonal imbalances caused by age-related changes. What's the general dosage? We usually use 10 mg per day for our longevity protocols for the 10 days, and this course can be repeated twice a year. For restoration and regeneration, we use a 10 mg every other day for 20-30 days, and it can be oral administration for 10-20 days, but usually we prefer subcutaneous form. Side effects. Epitolone is generally well tolerated by most patients, but like any substances, it can cause some side effects, especially when misused or when the dosage is exceeded. We're talking here about the headache, weakness and fatigue, skin issues like redness or itching that may occur at the injection site, and it also can cause a sleep disturbance. Despite normalizing circadian rhythm, insomnia, excessive drowsiness may occur in some cases, especially when prolonged use. So epitolone is considered relatively safe peptides. However, it's recommended to consult with a doctor before starting the treatment to determine the appropriate dosage and any contraindication. But this is a general for, I think, any kind of peptides. Terzipatide. Now let's discuss it. A relatively new medication used primarily to treat type 2 diabetes and obesity. We will talk a little bit more about these peptides, and we will compare with these peptides with the retatrutide, Ozempic, and other in our next lecture. But today I will give you just a brief. So terzipatide is a synthetic peptide that combines the effect of two important hormones, GLP-1, this is a glucagon-like peptides, and GIP, this is a glucose-dependent insulinotropic peptides. And these dual action make it highly effective in lowering blood sugar and promoting significant weight loss. So how it basically works? It stimulates insulin secretion. So when blood sugar is high, helping the body use glucose more efficiently. It reduces glucagon secretion, which lowers blood sugar between meals. It slows gastric emptying, meaning food stays longer in the stomach, making you feel full and reducing appetites. And through this combined effect, it supports weight loss, which is crucial for managing obesity and diabetes. Interestingly, terzipatide also supports brain function. So studies show it can improve memory, attention, and overall cognitive performance in patients with diabetes and obesity. So in summary, terzipatide is a promising peptide-based therapy that tackles blood sugar control, weight management, and even brain health. So what wraps up our overview of terzipatide? And again, just a quick heads up, our next lecture will be dedicated specifically to peptides for weight management. And there we will take a closer look at the main peptides used for controlling weight, compare their effectiveness, and learn how to use them safely, properly in clinical practice, how to prevent side effects. So stay tuned. It will be a very practical and informative session. So what's the main indication for terzipatide? It's a treatment of type 2 diabetes in combination with a diet, with a physical activity. In most of the protocols, we suggest to our patients start with a diet and implement physical activity in their life, start with a mitochondrial support first before jump to terzipatide treatment. We use it for weight loss treatment in patients with obesity, overweight, especially when metabolic syndrome is present, with support of cognitive function and improvement of brain performance in patients with a type 2 diabetes and obesity. So terzipatide is given as a subcutaneous injection once a week. The typical starting dose is 2.5 mg once weekly. And depending on how the patient responds and tolerates the medication, the dose can be gradually increased. So the usual schedule is to increase the dose by 2.5 mg every 2 weeks, starting at 2.5 mg and potentially reaching up to a maximum of 15 mg per week. But again, it makes sense, instead of jump to the highest dose of terzipatide, combine it, for example, with CGC pomorelin, tesamorelin, to help the patient build muscle mass at the same time, rather to load them with a high dose terzipatide, because in this case there is slightly high risk of first plateau and the second sarcopenia. So this gradual dose escalation helps tailor the treatment safely and effectively for each patient. And it's very important to monitor blood sugar levels closely when the dose exceeds 5 mg per week to avoid hypoglycemia and other side effects. So we not support that practice that happened here in the market when peptides prescribed in any single corner and patient just use it at home without any kind of support. No, there is supposed to be the guidelines, and we need to follow our patient to make this journey safe as possible. So what we need to monitor? Blood sugar level. It's very important, again, especially when we reach 5 mg and higher. We need to check kidney function, and liver function test. We need to check complete blood count to prevent the deficiency. It's because of our patient on tirzepatide, as it will suppress the appetite, they will stop it. So we have to be sure that there is no protein deficiency, no iron deficiency, no B12 or folic acid deficiency. So monitor your patient. We have to control blood pressure. We need to control lipids profile and especially vision, because the vision should be monitored very close, as many patients experience changes in their eye function, such as worsening vision or development of retinopathy, especially with long-term use and high doses. And again, we not recommend high dose and long-term. We usually, if there is no specific indication, if we're talking about especially weight control management, we try to keep our patient in the lowest dose in the shortest period of time as possible. So what's the side effects? Well, tirzepatide is effective. It is important to be aware of possible complications and side effects. There is a risk of thyroid cancer, specifically medullary thyroid carcinoma, observed in clinical studies. So carefully monitoring is essential. And I'm suggest not to prescribe this medication in patients with a family history. A rare but serious complication is optic nerve stroke, which can cause vision loss. If this acute, treatment must be stopped immediately. Some patients may experience blurred vision, usually temporary, and it's usually related to blood sugar fluctuation and metabolic changes.